Good morning from breastcanceranswers.com. I'm Dr. Jay Harness. I'm the medical director at Breast Cancer Answers, and joining me today for a live Google Hangout is Maria Fowler. Maria, welcome to Breast Cancer Answers.
All right, thank you, Dr. Harness. I'm happy to be here today.
Yeah, great to have you. And to give our audience a heads up, and we've been telling them over our Facebook page and our Google Plus page and Twitter that we're going to be talking about metaplastic breast cancer. Good grief, Maria, how do we explain what metaplastic breast cancer is to the lay public?
Yeah, well, it's a little bit complicated. In fact, one of the things that complicates it is the fact that it so closely sounds like metastatic breast cancer. And that can be a pretty bad confusion to make. Metaplastic breast cancer actually is less than 1% of breast cancer diagnoses are metaplastic breast cancer. And there are a couple of specific things that are characteristics of metaplastic breast cancer in most cases. And what happens is that the tumors that are found for metaplastic breast cancer patients often are a mixture of other things. Sometimes they don't even include actual invasive ductal carcinoma or the regular sort of normal kind of breast cancer. In fact, often what they do is they include other kinds of cells. Normal breast cancer arises out of glandular cells, and metaplastic breast cancer often arises out of cells that are normally found in other areas of the body, like skin cells or bone cells or muscle cells and things like that. So it's a pretty rare form of breast cancer, and it has some very specific characteristics. Oftentimes it's larger when it's diagnosed. It's very often grade 3, which is a very aggressive form of breast cancer, which kind of might explain why it can be larger at diagnosis, because it'll grow fairly quickly.
Okay, well, let me just stop you for a second.
Okay.
I need to point out to the audience that you're not a physician, but boy, you are encyclopedic about this. I want to congratulate you, Maria. I was thinking last night, now how do I explain this to the audience? You've done it perfectly. And so metaplastic, in other words, there are other cells. So, for instance, squamous cells that we often think about as being associated with oral cancers or skin cancers or whatever. So there's a squamous metaplastic. As you pointed out so beautifully, there's an adenosquamous metaplastic. There are other forms of metaplastic that can have cartilage in it, for crying out loud, or little elements of bone. And so you've just absolutely summarized it perfectly. I'm giving you an honorary MD here this morning, okay?
Thank you.
You're welcome. So how do we alert our audience about this? Women are naturally worried about breast cancer all the time. We've had several videos here at Breast Cancer Answers about the importance of screening, but you were talking a minute ago about sort of the more advanced or later presentation. So share with our audience what some of these unusual characteristics are for metaplastic breast cancer.
Right, right. So I kind of started on a little bit of it. Yeah, so they're often larger at diagnosis and grade 3. And so I think that sort of speaks to why it's so important to do self-breast exams, because oftentimes you're the one who can first notice that lump. And I know, just anecdotally speaking, a lot of the women that I talk to do find their own lump, or find the lump not too long after maybe they had a mammogram, or even, like in my own personal case, a mammogram never really saw the lump itself, and I had to do further studies. So anytime you feel a lump, I think it's definitely important to follow up and make sure that you're getting a clear understanding of what that lump might be.
Yeah, let me just interrupt you for a couple of seconds, because you're so encyclopedic. I'm going to have to jump in here periodically to slow you down a little bit, because you're making so many important points here. Number one, breast self-examination. Well, breast self-examination is not the be-all and end-all for the diagnosis of breast cancer. Women should certainly learn what their bodies are like, and you're really emphasizing this. You're also emphasizing that metaplastic breast cancer may not be seen actually with routine screening, and we can talk a little bit more about that later. Further, one of the really classic mistakes is if a woman feels a lump and then has mammograms, and the mammograms are, quote, negative, oh gosh, I don't have anything to worry about, is not true. You need an ultrasound examination to see what's going on, and if that doesn't give an answer, potentially a breast MRI exam. So anyway, I don't mean to keep interrupting, but you're dropping pearls everywhere here, Maria. I got to jump in and make sure our audience picks those pearls up. So please go ahead.
Okay, so yes, I agree with you, by the way, on the following up. In fact, I'm just going to speak from my own case again. Sonograms usually do see those lumps fairly well, and they can also help the doctors distinguish whether or not it's a cyst or something that they can easily tell what it is. So definitely, I think if you have a lump, you need to make sure that you're getting a complete view of what it might be. So a little bit more about metaplastic breast cancers, though. About 90% of us or more are triple negative breast cancer. So that maybe takes a little more explaining. Basically, most breast cancer, about 80% of it is the growth of it is fueled somewhat by three things: estrogen, progesterone, or something called HER2. And so, do you want me to continue?
No. It's important. About 80+% of breast cancers are hormone positive. These are the receptors that we measure on the cancer cells themselves. And so then typically then, as part of the adjunctive treatment of the breast cancers, the invasive breast cancers, a woman will be on an anti-hormone pill. And so we've talked a lot here at Breast Cancer Answers about breast cancer being a galaxy of diseases, from almost very benign acting that we even debate about whether we need to do anything about, to very, very aggressive. And clearly the triple negatives, Maria, are over on the aggressive side. And we don't have, as you're pointing out, we don't have an anti-hormone therapy as part of our armamentarium, if you will, of things to treat it. So please keep going. You're on a roll here.
Right. So exactly. So the main element of the TNBC angle of metaplastic breast cancer is just that women who have this form of breast cancer don't have any additional options for treatment after surgery, chemotherapy, and radiation. Things like tamoxifen, etc. They wouldn't affect these tumors at all.
Right. No, I absolutely agree with you. So, and just to point out to our audience, we typically talk about 3 grades of breast cancer: low grade, intermediate grade, and high grade. Typically the high grades, as you have pointed out, are faster growing. Also, pretty typically, the triple negatives and often the HER2 positive breast cancers, which are over here on the aggressive side, they tend to grow more quickly and be a higher grade as well. So please go ahead. You're spot on.
Okay, so terrific. So most of us, and so this is also kind of a little bit key to metaplastic breast cancer patients, and that is most of us are triple negative, but not all of us. So there is that whole nature of the tumors being mixed. Like I said earlier, so some people may have squamous cell or spindle cell or osteoclastic cell in their tumor. Some women also have a little bit of that invasive ductal carcinoma or other kinds of more normal kinds of breast cancer mixed into the tumor. And so some women do have the option of taking hormonal treatments after their primary treatments, but most of us don't.
Right.
Okay, so a couple more things about metaplastic breast cancer are that that it's considered by studies. Now, keeping in mind that because of the rareness of this disease, there are not a lot of really gold standard type studies done on it. There are some studies, but not like the big, massive 100,000 women were studied, and we know definitely this is what works best, and this is what the tumors are like, and everything's similar, or there's a real direction for the care of metaplastic breast cancer. That's not really going on right now. So it's considered by most studies chemo-resistant, and I think that they use that expression because there's a high rate of recurrence with metaplastic breast cancer. And in fact, there are a few studies that say the rate of recurrence is up to 50%.
Now, let me interrupt right there, because this is an important point. We talk here at Breast Cancer Answers about basically two types of recurrence. One locally within the breast, and the other elsewhere in the body, or what we call systemic failures. Now, why don't you amplify on that 50% failure rate, Maria? Is this locally and or systemically, or give us some more data on that? I think this is really important.
Yeah, I would love to give you more data on it, but unfortunately, there really isn't any more data on it. I don't think I've seen a study, anyways, and certainly that doesn't mean just because I haven't seen one that there isn't one. But I think it's both, because I know women who both have the local recurrence, which I think for a lot of you can correct me on this, but I think for a lot of doctors, a local recurrence speaks to maybe there's some cells left behind right there in the area where the tumor initially was.
Yeah, a couple of thoughts on that. One is, there could be cells left behind microscopically, even though the margins, the edges around where the cancer are negative. We often think of these as being stem cells that have been left behind. Then there's a whole other theory when it comes to breast cancer, and it's called circulating tumor cells. A lot of work being done at Memorial in New York on circulating tumor cells, and frankly elsewhere, that somehow these cells, while we remove the primary cancer, can still be in circulation and, if you will, repopulate where they came from originally. My own personal experience with Metaplastic is exactly as you're saying, that there's about a 50% chance for recurrence. What I worry about the most as a breast surgeon is that local regional recurrence. Even though we've done and tried chemotherapy, because you're right, most of them are triple negative, and we've added adjunctive radiation therapy, we can still then get a local recurrence, and it's most discouraging. But I'm with you. I think the rate of recurrence is both what we call local regional as well as out elsewhere in the body.
Right. Again, anecdotally speaking, I help administer a Facebook group, and we have over 200 women in the group right now. And so I hear from a lot of women about their personal experiences. So just speaking from what I'm hearing, there are women who get that local recurrence, and then they're able to go back in. Maybe they didn't have a mastectomy the first time, so maybe the second treatment is a mastectomy and then additional chemotherapy. So there are women who are having that happen. In my own case, I had a recurrence, and the oncologist decided that he thought it was a second primary because it was in the same side in the same breast, but it was 6 or 7 inches away on the other side, so to speak.
Yep, no, I've seen this as well, and that goes back to this potential theory of circulating tumor cells, if you will, coming back to sort of home base. Well, please go ahead. So, we don't want to discourage people completely here, Maria, but you're sitting here looking bright and charming and encyclopedic on the disease. What kind of things can we add as hope for people with metastatic breast? Excuse me, I made the mistake. I said metastatic instead of metaplastic with metaplastic breast cancer.
Well, what I always tell women when they're first diagnosed is, or anyone who asks me, is that despite the fact that our prognosis is considered somewhat worse, most of the statistics that I see, and once again, studies are limited, but most of the statistics that I see put survival rates at 65 to 75%. So that's not a terrible number. It's certainly above 50%. It's better than inflammatory breast cancer, I believe. I think their rates are around 40%. So there's still plenty of hope that you can be treated and that you'll survive your experience with metaplastic breast cancer if you're unfortunate enough to have that. Right. The other thing is that while almost all of us are offered chemotherapy, and there's this idea that it's chemo resistant, the truth is that chemotherapy is probably working, and once again, I'm quoting studies just that may not be the gold standard, but I think that most oncologists figure that there's like a 30 or 40% chance that the chemotherapy is working, depending on that mixture. See, this is part of the trick, depending on that mixture of your individual tumor. And so taking the chemotherapy is actually something that a lot of women do choose to do, even though it's possibly considered chemo resistant. You don't know that yours isn't, and that treatment might be just what you need.
Yep, I completely agree with you. I think you're also making a couple points here that I want to emphasize. Number one, you need to be in the hands of a multidisciplinary team. Given the rarity of this cancer, certainly that would include university type, comprehensive type cancer centers where you've got a multidisciplinary team of dedicated breast surgeons, dedicated pathologists, dedicated breast medical oncologists and radiation oncologists, physical therapists, etc. Often, Maria, these slides need to be reviewed elsewhere, that the diagnosis may not be precisely correct. And so if there's even a hint of this, I think both you and I would strongly suggest to people that they get a second and even third opinion, particularly a review of their slides. And so we've emphasized this theme of multidisciplinary breast care here a lot at Breast Cancer Answers, and I think your situation and the Metaplastic situation is a classic example of that. A couple things, though, that I think are important on the hope theme here. Tell us how we find your Facebook page and how women may follow you on Facebook.
Oh, yes. So I have a Facebook page and a website. And first of all, just to let you know, the website is sort of a public-facing view, so you can just go there and get similar to Breast Cancer Answers, explanations about metaplastic breast cancer written in plain English by myself and the other women that helped me create the website. And so that website is www.metaplasticbc.com. And I can show you a screenshot of that if you have a second.
Sure, we'd love to see it. Absolutely,
right.
Please.
Let me get that right here. And so here's our website. Can you see that?
On my monitor I cannot, but that doesn't mean our audience can't see it. So. Okay,
well, I won't spend too long on that, but it's once again, it's www.metaplasticbc.com.
All righty.
So.
And then on Facebook, how do people follow you on Facebook? They would link, I would assume, through your site, and then, but what if somebody's just searching sort of independently?
Yeah, so if you search for Metaplastic Breast Cancer Research and Information on Facebook, you'll find our group. There's also a link off of our website, which I'm going to go and update right now and put it in a little bit more prominent place for anybody who's looking for it. And the Facebook group is a private group because a lot of women feel like, you know, they're sharing some really tough times and they just are looking for a little bit of support. So it's both a support group but also a group where we discuss the latest research, because I'm going to give you a little point here. I think because of the recurrence rate, a lot of women continue to be interested in this diagnosis even after they're done with treatment for a little while. I think that kind of motivated me, myself, a bit. Whereas maybe if you have invasive ductal carcinoma or maybe DCIS, you get your treatment and you feel good and you feel like a survivor and you can move on a little bit. Women with metaplastic breast cancer often are a little worried about that shoe that's going to drop, and so we continue to sort of bond and support each other through this group, reading studies and learning a little bit more about it so that we're prepared in case we need that information later.
Well, congratulations on that. I mean, these kinds, basically you've got your own advocacy group.
Yeah, in a lot of ways, and I think that, you know, we're trying to bond together so that we can maybe get the attention of a researcher or a medical professional that would be interested in doing some studies, and definitely my personal advocacy is working towards that right now, looking for people who can help us.
Yeah, when we think of the big cancer centers in the United States like Memorial in New York or MD Anderson or Roswell Park or places like that, Maria, do you know at any of those or some other locations where there are some current experts right now that people need to know about?
Yes, absolutely. In fact, MD Anderson is conducting the only metaplastic cancer trial right now. Dr. Stacy Mulder of MD Anderson runs a trial called the DAT trial. That's D-A-T. That stands for the drugs that are being used in the trial. You have to be metastatic and metaplastic. And it's also not limited to a breast cancer, so a metaplastic cancer can occur in other parts of the body. So she's had some success down there, and certainly they've had some success with extending life. But that trial, I believe, is going into phase 2 very soon. But certainly women in our group go and see her for a second opinion often. So she's somebody that a lot of women seek out. She's
Well,
probably seeing 50 or 60 of us.
wow, wow, fantastic. And so do you have a link or her name at your website so that if people want to follow up on how to get a hold of her at the MD Anderson?
I sure do, and definitely, and I have a link actually to donating to her trial as well, trying to make sure that we're supporting her financially. But yes, on the website there's a link to her. Just briefly, there's a couple more people places I'd like to mention, just because in my own case, as you sort of mentioned earlier, it's important to get a second opinion. In my own case, the doctor called me after my lumpectomy and said, well, she thought it was a benign tumor, but that it was this small possibility it could be this weird, odd thing, and she was sending it off to get a second opinion, which I'm very, very grateful to her for doing that and following up and understanding and knowing this is a possibility. And so she sent my slides to Vanderbilt, which has a pathologist there that's well known for rare cancers. And then there's also a pathologist at Sloan Memorial Kettering who's known for studying rare cancers. So certainly there are a couple places that you can go and get second opinions, and that they have a little more experience with this.
And you can probably provide those names and other
Absolutely.
kinds of things at metaplasticbc.com.
That's
Well,
correct.
Maria, as we wrap this up, any final thoughts? Your group is so lucky to have you as such a bright, articulate person, and it's been a real treat to have you here at Breast Cancer Answers. Tell us any final thoughts you'd like to share with our viewing audience.
Not too much, just the fact that even though we have those worst prognoses, you still have a good chance of surviving metaplastic breast cancer if you're diagnosed early. And so, of course, be watching out for lumps and make sure that you're following up with them fully with your medical team.
Very good. And I would ask you to please stay in close touch with us at Breast Cancer Answers. We have a newsroom at Breast Cancer Answers where we like to have any kind of breaking news stories. We would encourage you to please stay in touch with us and keep us up to date on what is a rare and unusual form of breast cancer, metaplastic breast cancer. Well, I'm Dr. Jay Harness at Breast Cancer Answers. She's Maria Fowler at metaplasticbc.com. It's been our pleasure to be with you today. Please join us again in the future for another live Google Hangout here at Breast Cancer Answers. Well, I still see the live button on. Hopefully we're getting disconnected here. All righty. Well, very good, Maria. I just on my monitor it says we're still live, but
Mine does as well.
yeah, I'm trying to wrap us up here. Rachel, if you're listening.